A great captain is a good leader in the cockpit. What makes him different from other pilots? I will explain you with an example. You all know that I'm a emergency physician. I'm a doctor who is specialist in emergency medicine. On a day-to-day basis, I see patients whose life is in danger. Many patients come to us gasping. So what is gasping? The patient is not breathing. His breath will be like this. That's it. He is trying to breathe, but he is not able to breathe. If you leave him for a few minutes, he will be dead. So these kind of patients, when we receive in hospital, we resuscitate. So what do you mean by resuscitation? We have to keep his breathing and his heart going on, right? We have to do CPR, and we have to make sure either we put a tube in the trachea or by any other method, we will make sure he is breathing. So generally what we do is, like, we call it a ET tube, endotracheal tube. We take a tube and pass it from the mouth through the throat into trachea, and then we give artificial respiration with the help of a ventilator or an ambu bag. So this is what we do on a day-to-day basis. Now there was this great doctor. She was the head of the department of anesthesia in SUT Pattam, Trivandrum. This hospital is in Kerala. I was a very junior to her. Ma'am I was posted under her for anesthesia postings. She was an anesthetist. Now one day ma'am called me, Vamsi, idhar aao. She asked me this question. Here, see, when you fail to put a tube in the throat, when everything fails, whatever you do, that the tube is not going into the trachea due to some reasons. What will you do? After around 1.5 years after this question is being asked to me, I left Kerala and then I joined Medanta, the Medcity. One day in my night duty, I was sleeping. I generally sleep a lot in my night duties, where my juniors or colleagues will take care of cases. There was a case where the patient had throat cancer, and this cancer was blocking his windpipe, so he is not able to breathe. He came to us in gasping. Now nobody was able to pass a ET tube through his throat because the cancerous growth was obstructing the windpipe from the inside. So we were not able to pass. I was not there yet, and then I was woken up saying, okay, this is the case, what can be done? See, I saw the case, and I asked them to try a bougie, that is a small, very narrow pipe, very narrow, let's say a rod kind of thing, which is flexible, and then you pass over it. You pass it, and then over it you push the tube. Not possible. And then they tried using a video laryngoscopy. That means when you open for the throat, you can see a video what is going on inside. So it was not possible for us to put the ET tube. Then that question, which exactly this was the scenario around like 2 years back, when Alice Baby Madam put me through that question, and ma'am gave me the answer also. Ma'am taught me without anything, when you are not able to do anything, how to properly, with just bag and mask, how to ventilate a patient with an ambu bag. The proper technique of holding the patient so that the air leak won't happen. And whenever I am in the posting in the anesthesia department in the operation theatre, ma'am used to call, Vamsi, do this, do that. In that 1 month, where I spent time with ma'am taught me, or perfected me in this technique of ventilating the patient using bag and mask. It may seem like a simple thing, which is not much useful, but believe me, the day, like what generally happens in this situation is, instead of passing a tube through the mouth, we put a hole here, and then you pass the tube into the trachea directly. We call it as a tracheostomy. Osti is a hole. Putting a hole in the trachea and then passing the tube directly from here is tracheostomy. That was also not possible, because once you cut through the cancerous growth, it is going to bleed a lot in most of the cases, and the patient is again going to aspirate or lose his life due to blood loss or aspiration into the lungs, the blood which comes out. So that was also not an option, but that can be done in the operation theater by ENT department, where they have proper materials, proper equipment to cautery or stop the bleeding. Right now, this patient has to be shifted to the operation theater, which would take another 20 minutes. Can he survive without a pipe in his throat for 20 minutes was the question. That day I said, it is my responsibility, it is Dr. Vamsi's responsibility to make sure the patient will survive until he goes to the operation theater. And I started my bag and mask ventilation. We monitored his saturation, and successfully we took him to the OT. We made a hole, and then subsequently that patient was discharged after surgery, radiotherapy, chemotherapy, whatnot. Even now, from their family, once in a while I receive messages like randomly for festivals, this Dr. Sahab, we are very thankful to you. So that made me a good doctor. Alice PP madam made me a very good doctor by teaching what happens, or asking me a question, what happens when everything fails. Similarly, a very good leader, that is the captain of an aircraft, will always think about go around in his back of mind. When something is wrong, he is ready to go around, while all other pilots in the cockpit are concentrating on the approach. Think about it. Now, don't be that idiot who says you are a doctor, you are not a pilot. How come you are commenting what is happening in the cockpit? Imagine you flying with the person who you love the most. Like, flying is a hobby to me. Like, I do that. Like, let's say you are flying with your father. Will you not think if something goes wrong, I have to go around? Or will you think whatever is wrong, I'll land this plane? Or will you be totally focused on approach, right? You will also have in the back of your mind, if something goes wrong, I will. So that is what I think a good leader in the cockpit will always be thinking. What if everything goes wrong? See you in my next video.